Today, I will discuss what rabies is. Contents. So we have here definition of rabies, causative agent, mode of transmission, pathogenesis and clinical manifestation, laboratory diagnosis, treatment, and prevention. But first, let's discuss what rabies is. Rabies is a serious disease of the nervous system that can cause death. Rabies daw ay sakit na naiiwasan na kadalasang naipapasa o nakukuha sa kagat ng rabid animals o yung mga hayop na may rabies. Rabies is preventable viral disease most often transmitted through the bite of a rabid animal. Ang rabies daw ay ipapasa sa tao ng ibang mga hayop tulad ng dogs, cat, foxes, and bats. Ito yung may mga hayop na may mga rabies. So, next slide. So, ito yung ating host and reservoir. So, ayan, makikita natin dyan sa slide na yan. Meron ditong bat, fox, dogs, and cat. So, next slide. So, punta naman tayo sa causative agent. Pero alamin muna natin kung ano yung tinatawag na causative agent. Yung causative agent ay organism or chemical that is responsible for development of a disease. So ano nga ba ang causative agent ng rabies virus? Yan, makikita natin dyan sa slide. Siya ay bullet shape or yung hugis bala. Yan, makikita natin dyan, yung parang may mga balahibo siya sa gilid, ganyan. Single-stranded RNA virus belonging to the genus Lyssavirus. Yung Lyssavirus ay yun yung nag-cause ng rabies. Family of Rhabdoviridae. Cannot cross intact skin. So, ito daw ay hindi nakakatawid o nakakapasok sa intact skin o yung damaged skin. Sensitive of heating, boiling, drying, UV and X-ray, sunlight, ether, and detergents. So, next slide. So, mode of transmission. So, ano nga ba yung mode of transmission ng rabies? Rabies virus is transmitted through direct contact, such as through broken skin or mucous membranes in the eyes, nose, or mouth, with saliva or brain, nervous system tissue from an infected animal. People usually get rabies from the bite of a rabid animal. So, yun nga, nakukuha daw yung rabies sa kagat ng rabid animal o yung mga hayop na may mga rabies. So, yan, makikita natin dyan sa slide kung paano naipapasa or napasok yung rabies sa ating katawan. Yung number 1, virus enters tissue from saliva of biting animal. So, yung virus daw ay napasok sa tissue ng ating katawan galing sa saliva o laway ng nakakagat na hayop na may rabies. Next, virus replicates in muscle near bite. So, yung virus daw ay nakikita sa muscle malapit doon sa kagat. Next, virus moves up peripheral nervous system to CNS or central nervous system in spinal cord. So, yung virus daw ay naakyat papuntang peripheral nervous system to central nervous system in spinal cord. O, yung sa spinal cord natin dito. Next, virus ascends spinal cord. Tapos, maakyat na papuntang spinal cord natin. So, next, virus reaches brain and causes fatal encephalitis. So, yung virus daw ay naabot na yung brain and gakos ng fatal encephalitis. So, ano yung fatal encephalitis? Yung fatal encephalitis po ay inflammation of the active tissues of the brain caused by an infection or autoimmune response. So, the last, virus enters salivary glands and other organs of victim. So, yung virus ay mapasok na sa salivary glands at sa ibang organs of victim. Yan. Next slide. Dito na tayo sa pathogenesis. Pathogenesis. After inoculation, rabies virus may enter the peripheral nervous system directly and migrate to the brain or may replicate in muscle tissue, remaining sequestered at or near the entry site during incubation. Prior to central nervous system invasion and replication, it then spreads centrifugally to numerous other organs. The case fatality ratio approaches unity, but exact pathogenic mechanisms are not fully understood. So, pagkatapos daw mag-inoculation, yung rabies ay makakapasok sa peripheral nervous system directly. So, ano ba yung peripheral nervous system? Saan yun? Your peripheral nervous system is the part of your nervous system that lies outside your brain and spinal cord. At yung rabies daw ay lilipat na sa brain o makikita sa muscle tissue. At mananatiling isolate sa entry site during incubation. At makalit ito sa centrifugally o proceeding in a direction away from a center. So, dito naman tayo sa clinical manifestation. Clinical manifestation. Rabies, a deadly viral disease, manifests in several stages. Una, meron tayong incubation period. Typically lasts 1 to 3 months after exposure. No symptoms during this phase. Pangalawa, meron tayong prodromal phase. Last to 10 days. Flu-like symptoms. Fever, headache, malaise, and discomfort. Pain or itching at the site of exposure. Neurological signs may appear. Anxiety, agitation, or yung a state of anxiety. And hallucinations. Hydrophobia o yung fear of water, pagkatakot sa tubig, due to painful throat spasms when swallowing. Aerophobia or yung pagkatakot sa air o hangin, due to spasms triggered by air movement. Yun. So, pangatlo ay meron tayong acute neurological phase. Meron tayo ditong progressive encephalitis or brain inflammation. Aggressive behavior, confusion, and delirium. Ano yung delirium? Yung delirium ay serious change in mental abilities. Paralysis, andito din yung paralysis, begins in the bitten limb and spreads. Ascending paralysis from limbs to head. Coma and death usually occur within 7 to 10 days from symptoms onset. So, pang-apat, meron tayo ditong furious rabies. Andito yung hyperactivity o yung a person may seem to move about constantly kahit sa sitwasyon na hindi man maaari, or excessively fidgets, taps, or talks. Andito rin yung hydrophobia and aerophobia. Yun nga, yung hydrophobia ay pagkatakot sa tubig at yung aerophobia ay pagkatakot sa hangin. At andito din yung seizures and paralysis. Yung seizure ay yun yung electrical activity sa brain. Yan. Yung paralysis ay alam naman natin, yun yung di mo magalaw yung iba mong mga muscle. So, panglima ay meron tayo ditong tinatawag na dumb paralytic rabies. So, andito yung weakness, paralysis, and loss of muscle function. Difficulties speaking and swallowing o nahihirapan daw siyang magsalita at lumumod. At andito din yung coma. So, next slide. Paano natin malalaman kung yung aso ay may rabies. So, meron tayong ditong change in behavior. Loses its fear of people. O, yun daw, natatakot daw sa mga tao. Aggressive. Agresibo o yung nagapang-atake. Bites unusual object. Stick, straw, and mud. O, yun nga. Mahilig sila magngat-ngat ng mga bagay tulad ng mga stick, straw, ganun. Mga lupa, ganun. Running amok. Tendency to run away from home and wander. Ito daw ay maari silang tawag doon, tumakbo papalayo. Yun man din, may nakikita tayong mga aso na takbo sila kung saan, ganun. Change in voice. Barks and growls in a hoarse voice or unable to bark. Ito daw yung tawag doon, nagabago yung kanilang boses, yung ganon. Tapos, yun, unable to bark, hindi daw sila makapag-bark. Excessive salivation, foaming at the angle of mouth. Ito yung nagabula yung kanilang kanilang bibig, yung ang dami nilang laway, excessive, yung namumuti dito sa bibig ng mga aso. Meron din tayong paralytic stage. Later stage paralysis of the whole body leading to coma and death. Last ay dumb rabies. Exciting and irritating stage is lacking. It predominantly paralytic. Dog withdraws from being seen and disturbed. Dies in about 3 days. So, next slide, laboratory diagnosis. Dito sa animals, in animals, the direct fluorescent antibody, DFA, test is commonly used. It detects rabies virus antigens in brain tissue. Rapid and accurate diagnosis help inform medical personnel promptly, potentially saving patients from unnecessary trauma and financial burdens if the animal is not rabid. It also aids in defining disease patterns and developing control programs. In humans, several tests are required due to the nature of rabies. Saliva, serum, spinal fluid, and skin biopsies from hair follicles at the nape of the neck are tested. Saliva can be tested via virus isolation or reverse transcription, followed by polymerase chain reaction, RT-PCR. Serum and spinal fluid are tested for antibodies to rabies virus. Sabi dito, maraming pagsubok daw ang kailangan dahil sa likas na katangian ng rabies. Ang laway, serum, spinal fluid at mga biopsy ng balat mula sa mga follicle ng buhok sa batok ay sinusuri. Ang laway ay maaring masuri sa pamamagitan ng virus isolation or reverse transcription na sinusundan ng polymerase chain reaction. Sinusuri ang serum at spinal fluid para sa mga antibodies sa rabies virus. Dito naman po tayo sa treatment ng rabies. No specific treatment. Case management. Isolation in a quiet room protected as far as possible from external stimuli to prevent spasms and convulsions. Relieve anxiety and pain by use of sedatives. Morphia 30 to 54 mg. If spastic muscle contraction present, use drugs with courier-like action. Ensure hydration and diuresis. Intensive therapy in the form of respiratory and cardiac support. Patients with rabies are highly infectious. Virus is present in all secretions like saliva, tears, vomits, urine, and other body fluids. present daw sa secretion like sa laway, sa luha, sa dighal, sa ihi at sa mga iba pang body fluids. Nursing personnel should be warned of risk and protect themselves with PPE. Person with open wounds and cuts should not attend the patients. O yung may mga sugat daw or ay kailangan daw ay hindi daw kailangan umattend or puntahan yung patient. In places where rabies cases are encountered frequently, in places where rabies cases are encountered frequently, pre-exposure prophylaxis 2 to 3 doses HDC vaccine recommended. Dito naman tayo sa prevention ng rabies. So, may dalawa tayong ditong paraan na kung paano maiiwasan ang rabies. So, pre-exposure prophylaxis and post-exposure prophylaxis. Pre-exposure prophylaxis. So, dito nakapaloob yung provided to subject at risk before occupational or vocational exposure to rabies. Subjects include diagnosticians, laboratory and vaccine workers, veterinarians, keepers, etc. Simplifies management post-exposure. Only vaccines used. Dito naman tayo sa PEP o tinatawag na post-exposure prophylaxis. Provided to subjects after rabies exposure. Consists of wound care, rabies immune globulin, and vaccine. Dito din yung cleansing, chemical treatment, and suturing. Anti-rabies serum, antibiotics, and anti-tetanus measure. Observe the animals for 10 days. Wash lesions well with soap and water. Tetanus booster. Infiltrate rabies immune globulin 20 international unit kilogram into and around the margin of the bites. Administer vaccines on days 0, 3, 7, 14, and 28. So, this is the end of my presentation. Sana ay may natutunan kayo.